Welcome, welcome, welcome. Welcome members from Moms Clean Air Force. Welcome members from Virginia Conservation Network, Sierra Club. Also, Elders Climate Action is here today. We have members from all over CCAN. We just really want to thank everyone for being here today and meeting with your legislators. It's time for all of our legislators to listen to us, and we are here to fight for our children's health. We have grandparents represented here today that are going to speak at the press conference, and we really want to make sure that we are looking out for all of our generations. We have moms and children, and we're making a big difference here today. My name is Tara Pascarosa with Moms Clean Air Force, and I represent over 600,000 members nationwide, over 14,000 members here in Virginia. So we are here to let our voices be heard. And our legislators are listening to our mothers today, and our grandmothers, and our children. Without further ado, I'm going to introduce one of our first speakers, and her name is Mona Safardi. She is an amazing doctor here in the state of Virginia. She's the director for the Program for Climate and Health at George Mason University at the Center for Climate Change and Communities. She has been a family medicine professional and physician for over 30 years. Let's welcome Mona Safardi.
Looks like I'm getting some applause from this little one over here too, which is great. Well, thank you so much for that introduction, and let me say that it's a tremendous pleasure to be here. I started working at George Mason 3 years ago. And had spent the prior 10 years in Pennsylvania, where I was at Thomas Jefferson Medical Center in the Department of Family and Community Medicine. And I have to say that it was in Philadelphia where I really started to learn about clean air, and so I want to tell you about that for just a minute. Philadelphia is a quote-unquote non-attainment zone, which means that it doesn't meet the EPA requirements for clean air. And I was teaching, and I invited somebody from the local Clean Air Council to talk to my class about clean air. And that was where I learned that I was every day going to work in a place that didn't meet the EPA requirements. And it was, kind of bowled me over. Like, what? You mean every day I'm coming to work in a place that doesn't meet the clean air requirements, and all of our patients who come to the medical center here are breathing this air, and that was where I first really began to understand about the issue. And so I have since come to understand how the increasing heat in the environment makes the air even worse. And if you look at a map of Virginia in the summer months, you'll see that the entire state can be yellow quality air, which is not as good as green quality air, and is actually dangerous for people who have health conditions. In the cold months, we don't have that. The air quality is good, but in the hot months, the air quality is not so good, and the reason is that heat and light take all of the gases that come into the air from any sources, power plants, emissions from any source, and actually transform them into ozone. And that ozone at the ground level irritates the lungs and makes a lot of trouble for people who have any kind of lung condition. So that might be asthma, it might be chronic lung disease, it could be heart disease, but that ground level ozone gets worse as it gets warmer. And then when we produce more power to produce air for air conditioning when it's hotter, more particles go into the air. And those tiny little particles also get deep into the lungs and cause a lot of problem for people who have any kind of lung compromise. And especially bad for kids whose lungs are developing. And if children breathe that air at a young age, their lungs don't develop properly. And so I am also a proud member of the Moms Clean Air Force, which at this point is 600,000 strong across the country. And I think is doing just a tremendous job of bringing these issues to the attention of the public. The reason I'm here today is not just that I'm a member of Moms Clean Air Force, it's also that Samantha Adut, who's a pediatrician, was supposed to be here, wasn't able to be here, and she asked if I would come down and speak in her stead. And so I want to read you just 3 examples of the patients that she takes care of that are affected. So Wesley, a 6-year-old boy that she saw in the spring, And he came into the office 3 times in April, tired, itching, with swollen red eyes, congested nose, and cough. He was already on an antihistamine, eye drop, and nasal spray when a cold tipped him over the edge and he developed wheezing and got admitted to the hospital. With rising temperatures and carbon dioxide concentrations, seasonal allergies are starting earlier, lasting longer, and are more severe. The U.S. peak in total pollen count increased by 42 to 46% during the 2000s, the early 2000s, relative to the 1990s. And ragweed turns out grown at higher carbon dioxide concentrations actually produces pollen, which has a greater impact. So the pollen becomes more potent when the plant grows in a carbon dioxide enriched environment. Grass plants also produce more pollen compared to lower concentrations of carbon dioxide. So, we're in the area here where we have tremendous allergy population. I'm sure many of you know it's about 30% of the population has hay fever and reacts during those months of the year, and some get into more trouble than others. She gives another 2 examples. So one is Sonia, an 8-year-old girl who came to me last fall for pain in her foot. She was ultimately diagnosed with Lyme disease. Lyme disease is spreading northward into regions that used to be too cold for ticks to survive through the winter. And there's now Lyme disease in Maine and Canada, and other tick and mosquito-borne infections are spreading widely across the globe. And Virginia, if you look at Virginia 2005 compared to 2015, there's been a tremendous increase in Lyme disease. And part of the reason is the spread of the tick under these favorable conditions, warmer conditions, with less cold winters. Just one more case that also comes from Dr. Samantha Adut. So Isaac is a clarinet playing 13-year-old who also happens to be her son. He was at music camp in 2011 during the hottest July ever recorded in the area. And on the last morning of camp, after walking up a hill, he collapsed and had to be taken to the ER in an ambulance for IV fluids, and for cooling. And kids today are experiencing record heat every year, and they've never experienced the same climate 2 years in a row. And the people who are at risk for heat exhaustion, heat effects, heat stroke are older people, the very young, and anybody who's spending a good deal of time outdoors. And that could be working outdoors, it could be playing sports outdoors, as school-age children often are, and in this case, Dr. Adut's son. So I know I'm supposed to keep my talk to a limited number of minutes. I'm happy to speak to anybody who wants to talk more about the health effects of climate change and clean air. And I will be around later also for presentations. Thank you.
Thank you. Thank you so much, Wilma. We really appreciate having you here. Come on up, kids. A couple of the kids are going to come up with me because we're going to introduce their fearless leader. We have a grandmother here with us today. We have several grandparents, but Angela Harris is the founder and CEO of All From One, Inc. It is a nonprofit charitable organization which is dedicated to improving the quality of life for youth residing in the southeast community of Newport News, Virginia. Currently, Ms. Harris serves as the Youth Community Coordinator for the Southeast Care Coalition. And what do we want, you guys? Clean air. That's right. And we're going to go ahead and bring Angela up so she can talk to us a few minutes about being a grandmother and about what we want for our kids.
All right, y'all. What is asthma?
Asthma is the disease of the lungs.
Hi, I'm honored to be here. It's a pleasure. Thank you again, Mom Clean Air Force, and I'm happy to be a part of this movement that is global and not just on the local level. It's important that we all come together and teach the children how to take our place. Each movement stops because we don't teach the children. We must put boots on the ground. We must teach the children what we're talking about, or just stop talking. We must engage the children on every level to take our place. I know it sounds bad, but it's the truth. If we're not teaching the children, we're not doing anything. we must make sure that we put focus on asthma. Asthma is killing our children. Children can't breathe. The increase in the schools. Asthma, access to things that the children need to make sure they can breathe. Asthma pumps. Where is the organization that's out here for the children? Boots on the ground. Our people are dealing with flooding. Every time it rains, we flood. We need to think about that. We need to talk about people that comes into the community just to use your numbers to get federal dollars and federal funding, and the funding that's allocated never goes to the communities in which the funding is for. We need to talk about that. We need to not turn the cheek. We need to have our race conversation to make sure that everybody is on the same page and that we care about all the children, not just the children that we give birth to. It's our job as women to make sure that the women come together for the sake of the children. We need to start a DEVA movement. DEVA stands for dedicated, intelligent, versatile, articulate, mothers of civilization. Again, if we're not training or teaching the children to take our place, then we're not doing anything. Now let's make sure that any organization that you are part of, that they form a youth group if they don't have one. It's our job, y'all. We need to stop talking about what the children don't have, and we need to do something about it. If you hear someone talking about the children, stop them and tell them that's not God's way. See, people talk about Jesus, God, their faith, but what we see out here in the United States and the Americas, that's going on with our children, we all should be ashamed. Get up, do something. Lead by example. Thank you.
Thanks so much, Angela. It was wonderful hearing about how and why we should involve the youth in this movement towards climate action. My name is Kendall Proper. I am the Richmond Conservation Program Coordinator for the Virginia chapter of the Sierra Club. And our next speaker will be Senator McEachin. In 2007, Senator McEachin was elected to the Virginia State Senate with an overwhelming victory. Re-elected in 2011, Senator McEachin was honored by his colleagues and elected as Senate Democratic Caucus Chair. In the State Senate, he is proud to be a leader in non-discrimination, environmental protection, women's rights, energy efficiency, public education, and job creation. Senator McEachin.
Good morning.
Good morning.
Although I don't know that I really want to follow our last speaker. She was awesome, right? One of the things I wanted just to talk to you all about today is the Reggie bill that's Delegate Villanueva and I are carrying. And there are basically three things I want you to take away about that bill. First of all, what is Reggie about? It is a regional greenhouse gas initiative, which is a voluntary program of 9 mid-Atlantic and Northeast states that caps pollution and provides resources for energy conservation and other uses to states. The bill that Delegate Villanueva and I have is designed to raise $250 million annually for the state to reinvest. The bill would take 30% of that revenue, or $75 million, to invest in energy efficiency programs that help lower bills for families and put Virginia on the path towards meeting our energy efficiency goals. Half of that amount that I just talked about, that $75 million, is designated for low and moderate income renters and homeowners, so that those who can least afford to pay high energy bills will be able to keep more money by redoing their homes and making their homes more energy efficient. Not only is that good for their pocketbook, not only does that consume less energy, but it's good for the environment as well. So we all think of the Reggie bill as, the Coastal Protection Act, which it is. It's incredibly important because of the things that are going on in Hampton Roads, and that Hampton Roads is basically sinking if we don't do something about climate change. But there are other benefits too, and those are just some of the benefits that bill brings. I'll be happy to answer questions after we're done. Thank you.
Thank you so much, Senator McEachin. Our next speaker will be Senator Rosalind Vance. Senator Dance became the first African-American female senator from Petersburg on November 4th, when she won an election for the 16th Senatorial District. Senator Dance was officially sworn in on November 24th, 2015. She currently sits on the Senate Privileges and Elections Committee